Leonard Sophia once said, in crisis management, be quick with the facts, slow with the blame. The past few weeks have been met with almost a collective sigh of relief over the COVID crisis. But the clearing in the woods is still a ways away. The death rate is still sky high and family islands are struggling through this latest surge. Hello and welcome to On the Record. I'm your host, Jerome Sawyer. We are truly in unprecedented times. A new government, barely more than a month in office, is facing a COVID crisis as a major agenda item. Vaccinations remain below 50%, and with the often controversial emergency orders ending next month, what's the next step? Tonight, we examine managing the healthcare crisis. Joining me on the record, the man whose job it is to answer that question and much more. Don't go away, our conversation begins on the other side of this break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer. Tonight we're discussing managing the healthcare crisis. There is hope at the end of the tunnel, at least that's the view of the new Minister of Health, Dr. Michael Darville, who recently announced that 200,000 vaccinated Bahamians will take us to the 50% mark. Though getting there may be a bit of a challenge, as there is still a lot of vaccine hesitation out there, even though the severe illnesses and deaths remain mainly among the unvaccinated. My guest, of course, is the Minister of Health, Dr. Michael Darville. Sir, welcome to On the Record.
Welcome, and I'm glad to be here, Jerome, and to the Bahamian population, welcome.
Sir, first of all, I want to congratulate you on your election win, congratulate you on the appointment. I know that health was in view for you while you were in opposition, and you certainly were the spokesman on health. But I've got to ask, what has it been like for you these first few weeks in office in the most talked about, the most focused on ministry, I would say even in the world right now?
Well, Jerome, first of all, it's not been easy. We all anticipated that in coming to office, we would meet severe challenges, and just as we anticipated is where I am today. In the Ministry of Health, there's fires burning everywhere, and on a daily basis, I need to hop out one and jump into the next. And so as I began to pace myself and begin to assess what's going on globally as it relates to health, I began to realize that now at 6 weeks as being minister, I need to be focus driven. And so you will begin to see me tackling one thing at a time and doing it effectively.
I don't envy you. I know from my years of journalism that health is probably one of the most dynamic, stressful, demanding ministries just because of what it's about. But once you add COVID onto that, I know that it's going to be a very delicate juggling act for you. So we wish you all the best in that. One of the issues that you and even the ministry and the country is facing is this issue of vaccinations. As we would have said in the introduction, there is still a level of vaccine hesitancy. Is this government, or when you look down the road, is this government ever prepared to mandate vaccinations?
Well, as it stands right now, the government policy is the vaccination program is completely voluntary. Mm-hmm. And while we were in the campaign mode and we were working towards becoming government, we made it very clear that one of the key ways to deal with vaccination hesitancy is to ensure that you put a strong public education program in place. As minister, one of my first objectives was to ensure that I put together a communication task force with some specific objectives, and that's basically to go after those individuals who, for whatever reason, feel that vaccination is not their option. We believe that we have a strategic plan to combat that, and we are very pleased that to date, we are now having individuals who fell into that category now taking it very seriously because they see the effects of COVID and strong possibility of hospitalization and possibly death, particularly for individuals who are not vaccinated. That's very important, sure. And we will definitely be able to start the necessary public education programs everywhere in order to reduce vaccination hesitancy in the Bahamas.
You know, some health experts have said, and in other parts of the world, that really this is a pandemic that is existing mainly among the unvaccinated, even though those who are vaccinated are still at risk of catching it. Numbers are showing that the severe illnesses and the deaths really are in large part with the unvaccinated. So hopefully that message resonates. If the government will not mandate vaccinations in the workplace, would you be willing to provide some legislation for employers to now mandate it in the workplace?
As we speak, Jerome, our administration now are looking at ways with new legislation to do a better job to ensure that individuals who are in the workplace are protected, and whether that will come from testing, whether it will come from making sure that we institute better public education at the workplace to bring those individuals who are still hesitant to be vaccinated on board. But it is a joint effort, and we had this discussion a few days ago when I had the opportunity to speak with representatives from the United States who are blessing us with our second tranche of vaccines. Mm-hmm. They are concerned, and they have reached out to us on ways on how to address it. In some parts of the world, in the workplace, testing is being done for individuals who are not vaccinated. You see it's happening at our hotels. And it's a possibility that that may be implemented with our new free testing regime. So we're looking at many ways on how to address the issue because as it stands right now, vaccines are voluntary in the Commonwealth of the Bahamas.
But I'm sure that, I don't know if you've had an opportunity though to speak with business owners, because some of them have expressed that concern because they, particularly those who are involved in the tourism business, you know, they are at risk and sometimes feeling even that their guests are at risk, or people, you know, patrons of the business are at risk when there is this hesitancy and there is really no, I guess, legal protection for some businesses who want to mandate it.
You're absolutely right. And so it's very important for us to begin to consult with the business community to come up with legislation that is user-friendly, that would not take away an individual's choice One of the things that I feel is important is that with free testing and the digital platform that goes along with it, with contact tracing and surveillance, we will do a better job to be able to determine individuals based on new legislation that we bring that is associated with them dining in restaurants, if they are vaccinated or unvaccinated. And there's many countries in the world where we have the digital means of monitoring and contact tracing and surveillance to be able to do a better job to identify those individuals who are at risk, unvaccinated, and want to access public places where the rules may require vaccination indoors. And so with that digital platform, we will definitely have a better opportunity to be able to improve commerce and allow business places who want to open up to be able to do it in a more cost-effective and a better way.
There are the constant discussions about the rights of the unvaccinated. However, many vaccinated individuals, myself included, are concerned about our own safety. Who's standing up for the rights of the vaccinated?
It is the government's responsibility to stand up for the rights of the vaccinated and the unvaccinated. And it is a difficult thing to do, to find legislation to be able to do it simultaneously. Because what you do for the goose, you may not be able to do for the gander. So it is a complicated thing, Jerome. And countries around the world are faced with the same challenges that we have. I do not have the answer for that question now, but I assure you that we have been discussing it, trying to find common ground to protect the vaccinated and the unvaccinated.
Minister, it's probably one of the most divisive issues I've ever seen in my lifetime. As a vaccinated individual, sometimes I have to dial back my own response and understand, as you have said, that everybody has a right, yes, and people have a right to choose. But I can't imagine, though, having to get the two sides to the table to be able to find a happy medium. And there are lots of emotions on both sides.
There is large discrepancies when you sit to the table with an individual who is unvaccinated and listen to their concerns versus an individual who is vaccinated and listening to their concerns. These are deep emotional divides, and we believe that public education and policies to ensure that individuals who are not vaccinated follow the necessary testing protocols that would not put themselves at risk and not put other people at risk. But it is a choice,
and I'll tell you,
we must respect that choice.
Definitely. And one of the challenges I'm hoping that this government tackles is the amount of misinformation that is out there, and there's misinformation on both sides. I will say that as well. I see, as a vaccinated person, I know that sometimes there's even misinformation in some of the things that we think and say. So there's lots of misinformation. So you're quite right in that there needs to be a lot more education out there. So let's talk a little bit about the free COVID testing. This is obviously going to be an expense to provide that free COVID testing. How are we going to pay for this? Or, how are we going to offset these costs? Because at the end of the day, the test costs money. And as it stands now, when we want to travel, we can find that however much money to take the antigen test, or if you need a PCR, we can find the money. But, even some businesses have stopped paying for the tests that are required for employees. So, if the government is now going to bring free testing, I know you've already started it, how are you going to offset those costs?
Well, first of all, Jerome, we in this administration made a commitment to the Bahamian people in our 10-point plan to clearly indicate that we will use more innovative means to handle and to control the pandemic. We've made it very clear that the draconian measures that we had in place with the former administration and lockdowns, I don't think you can find a country in the world that are using those techniques anymore. The way forward for us as a country is to live with COVID and control the clusters of COVID that exist. COVID is an invisible enemy, and the only way you're going to know where it's at with an asymptomatic person is if you test. And so our job is to improve our tools in the toolbox to be able to police this pandemic and to do a better job in controlling it while we begin to open sectors of our economy. If you look, you would see that in the cruise line industry, it's clear. If you want to cruise and come to the Bahamas, you need to be fully vaccinated. And so when you go downtown now, when all the shops were closed, I was pleasantly surprised when I was downtown yesterday. We're beginning to see tourism starting to move. We must be able to find the resources to be able to find COVID, to have clusters of COVID control, to make sure that there's no community spread. And the way that's done is with testing. Yes, it would be a cost to the Bahamian people, but that cost will be minimal to compared with the economic benefits that we will have as our economy begin to open. I've started our pilot projects in the Family Islands for good reasons. We've had some moderate clusters in many of our Family Islands where the healthcare infrastructure is not up to par. And so our job is to make sure that when we do have clusters, we initiate the protocols, get the clusters under control. Those who are in isolation, they spend their time in isolation. Those who are in quarantine, spend their time in quarantine, and then the clusters dissolve. Only for a new case to be imported and another possible cluster to start all over again. So testing is absolutely essential.
And I think that has always been, or that was one of the biggest criticisms against the former administration. People felt that there was not enough testing to be able to get a handle on the situation. Our great neighbors to the north, the United States, looking to make it mandatory for non-Americans to come into the United States to be vaccinated. Have we been able to quantify what effect that has had on our vaccinations? Bahamians love to go to the United States. I mean, from what we saw, there was an uptake once it was thought that this would happen. Have we seen that trend continue? Are you able to sort of say what?
Yes, it definitely had a positive effect on our vaccinations in the Bahamas. And last week, we have now put in place more vaccination appointments. If I'm not mistaken, I think it's about 10,000 appointments for New Providence. And that has been going relatively well, but we are also pleading to the Bahamian people to please come and get vaccinated. And the vaccination, mainly Pfizer, and there's also Johnson & Johnson. And so as I speak, we are beginning to see signs where more people are coming now for those appointments, and we are opening up new pop-up centers and trying to get vaccination protocols and sites to the people rather than the traditional places.
I make no bones about it. I really am an advocate for vaccinations, and I always hope and pray that more people see the wisdom in it. Looking at the numbers coming out from the Ministry of Health on a daily basis, we see a downturn in the numbers. We are nowhere near what we were several weeks ago. Are you able to say what would be the reason for what appears to be the lowering of our new COVID cases?
Well, we're pleased that from our statisticians, we're beginning to see cases drop, and that's good signs for us in the Bahamas. The reason why that's good for us is because the world is watching, and as we speak, the Bahamas is now classified by the CDC as level 4. They're watching our country very closely. They're watching what we're doing in vaccinations. They're watching our numbers. And we feel that we have a legitimate case now to petition the CDC to ensure that where we are at level 4, we more likely can drop to level 3. And that is all in part of the way our vaccination program is going and the limited public education that is presently happening with our ministries, as well as the media, that Bahamians now are a bit more concerned about when they become positive and watch their symptoms and seek medical help before they actually reach at that point where when they present to our tertiary facility, it's more complicated than the advanced stage of COVID illness.
Yes. Minister, we have so much more to talk about. It's your first time on the show, so I got lots of questions. Stay with us. We've got more on the record right after this quick break. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back. You're watching On the Record. I'm your host, Jerome Sawyer. Tonight we're looking at how this new government is managing the healthcare crisis. People with non-communicable diseases are at higher risk of a severe case of COVID-19 and possibly death. This is particularly alarming in the Bahamas, where the obesity rate and non-communicable diseases like diabetes and hypertension are disproportionately high, yet less than 50% of the population is vaccinated. Minister of Health, the Honourable Dr. Michael Darville, is my guest this evening on the show. Sir, as we went to the break, we were talking about decreasing numbers, but what we have also noticed is as the numbers have decreased, the death rates remain high. I'm not going to ask you, obviously, if this is an area of concern, but how are we addressing that?
Well, Jerome, we have one of the most unhealthy populations in the region. And we knew it even before becoming government. The facts are there, the research is clear. And this is one of the reasons why the Ministry of Health has now been renamed as the Ministry of Health and Wellness. Wellness is absolutely necessary because if we stay on this same trajectory with chronic non-communicable diseases, it will begin to balloon our resources in order to be able to handle the health crisis that would follow. And so in this term in office, we would be developing a stronger arm to address the issue of wellness. This was brought to our attention during our last administration prior to the launch of NHI. And we realized that we need to do a better job in educating our people on lifestyle changes that will improve the quality of health and prevent many people from falling into the trap of non-communicable diseases. That is one of the key. And as we begin to look at the death rate, and we look at the rate of obesity, diabetes, and other non-communicable diseases, we all know that if you contract COVID and you are unfortunate to be one of those who have symptoms because of your non-communicable diseases, the chances of survival is affected as a direct result. And so it's a combined factor. And then to compound that, with the Delta variant, many individuals present with severe complications at our tertiary facilities, which had complications even before COVID. And so the gaping holes that are there is a direct result on the demand for the system, and we are not prepared for the demand. So it's a compounded issue that we need to correct in our term in office. It is complicated because you can't do it overnight. It'll be great if I had the capability to swing a magic wand at our resources and say, let it be. Unfortunately, that's not the case. And so we're managing it, not only at our public facilities, but in partnership with our private facilities.
If we are honest with ourselves, you know, when people present with hypertension, diabetes, even obesity, the proverbial horse is already out the gate. And while the medication manages it, it does not treat the root problem in many instances. And you're the doctor, so you should be telling me these things. But are we looking at addressing it really from the root causes? And that's the lifestyle. And by that I mean, you know, when you say Bahamian food is peas and rice, macaroni, coleslaw, potatoes, one plate, you know, we eating corned beef and grits for breakfast. Yet, when you go to grocery stores and other places to buy food, your salads, your greens, your vegetables, those are on the higher end of the price list. Yes. And so it's cheaper to eat corned beef and grits. You know, so are you looking to, you know, look at to address this from a holistic perspective? Because the medication and the treatment, that's when the people have already developed that. And they're developing it in astounding numbers.
Yes. Healthcare is holistic. And healthcare and wellness, they go hand in hand. For medical professions, it's important for us to be able to treat illnesses, but we must also be able to prevent illnesses. And so, yes, the government must look at delivering of healthcare systems throughout the country holistically. We need to look at choices in our diet. We need to look at accessibility to proper preventative primary care. We need to look at exercise. We need to look at child health. And we need to look at public education to begin to train our children, because healthcare modifications for those who are already undisciplined is much more difficult than for healthcare training for younger kids, begin to taking them in a new lifestyle and prevent chronic non-communicable diseases in that generation. Our generation, we have high instances of non-communicable diseases, and our job is to manage those cases to ensure that they do not decompensate and improve their quality of life, while simultaneously bringing the new generation in a complete new mindset of lifestyle modifications, which involve exercise, proper nutrition, proper mental health care, and education. All of these things must be happening simultaneously and globally in our communities in order for us to be able to come from where we are as one of the most unhealthy population in the Caribbean to where we need to be, and that is to be better equipped. And you know what's even amazing is that with non-communicable diseases, it affects our GDP, because the productivity of individuals who still have time in their work life and cannot perform. So we lose a lot of work hours that also affects our GDP.
And the cost of healthcare is so high as well that's driving it up as well. Something you said really struck a chord with me, and we've not addressed it at all in our discussion, is this issue of mental health. And we have some serious mental health issues in country as well. I think even from as far back as Dorian, you've got the pandemic, you've got economic issues, but just as an illness all by itself, we have not done a good job of addressing mental health. If you could for us, let us know where that is on your policy radar, and what kinds of discussions have you had, or have you had any at this point, about how we're going to address some mental health issues?
Well, mental health in the country is absolutely on our agenda and on our radar. I've made it very clear that on coming to office, this administration will be bringing to Parliament amendment or the repeal of the existing Mental Health Act and bringing a modern Mental Health Act in place.
When you say a modern Mental Health Act, help us to understand what that means.
Okay, the current act that we have is antiquated, it's old. A lot of the issues as it relates to dealing with mental health is not to the level for where we are as a country. And that needs to be brought to the forefront. And I've spoken to some of the individuals who are responsible for mental health, and they're very concerned with that act, whether or not we can control or to be able to deal with the issues in mental health using that piece of legislation. And so that legislation may have to be amended or completely replaced. And that is the issue that we are dealing with many of the experts who are responsible for delivering mental health in our country. But you said something that is very important. We've had multiple shocks as a nation to our economy and to our people. Our people in the northern region experienced Dorian. The impact of Dorian, even though it was in Grand Bahama and Abaco, the impact with the migration of individuals who lived in those regions into the capital and other family islands have not been adequately addressed. They are traumatized. Quite a few of them still have post-traumatic stress disorders. They're having difficulty to integrate into the new communities. They've lost everything. And I'm sure some of them have received some counseling from a pastoral level or even from a healthcare professional, but it is not adequate. And then to compound that with the pandemic, a few days ago, I had a discussion with some individuals in my ministry, and I brought the topic up. And in that meeting, one of the individuals lost a loved one. And just speaking about it, they broke down. And so it goes to show you that all of us have been impacted from COVID-19, and there's a lot of hurt. And we must do a better job to begin now to bring it to the forefront.
Mr. Minister, I'm going to say this and then we're going to move on. As you look at this legislation, keep in mind, and this is no disrespect, although I know I have church friends who can tell me I'm going to end up in hell, but we have to get to the point where we begin to differentiate praying for and pastoral counseling from real counseling. This notion that every time there's an issue, it's the devil or it's an evil spirit or and let me come lay hands on you, that's not the way to deal with these issues. And far too often, you have people who are religious practitioners who are functioning as mental health professionals in that they're praying for, and that's a problem. I don't know how much of it you know, but it is a problem. And these people aren't trained, and telling you that the devil is at the root of all your problems is not the way to solve it. That's just me standing on my soapbox for 2 minutes. But it is a consideration.
Well, we
and
have...
the choice people can tell me I can burn it out.
Yeah, no, but...
I need to say it.
No, but coming to the defense of our religious leaders, there are many religious leaders in this country who are trained as counselors. And when they utilize those skills to their congregation, we have effective results. And so I understand where you're coming from, but in the defense of the religious community, many of them are playing a very effective role. And we need to catch up because we are falling behind as a government in terms of providing these services for our people.
So maybe this is something we look at in legislation or even put in policy where these people are licensed or recognized as being licensed or recognized as being qualified, and there's a way for us to determine who is qualified to give this kind of advice. And you're quite right. There are a lot of religious leaders out there who provide that kind of counseling. I'm the beneficiary of some of that. I know about going to my priest to talk about things that are bothering me. But sometimes, these are out of these issues are outside of their scope and depth. And you're quite right. So maybe it is that we find that happy medium, because not to diminish the work that they do, but there are a lot of men and women out there who are men and women of the cloth who provide great counseling. So I just wanted to put that out there. But we've got to help our people who really, really need help.
Yes.
And so that's where we are. We talk about the testing. We talk about we've spoken about the hospitalizations. This all, of course, is compounding, as we also have spoken about the non-communicable diseases. All these things are a strain on the healthcare system. And of course, they are the day-to-day things that continue to happen. We provide a lot of services in this country for free. People walk into the hospital and get what they need and walk out without, paying a dime. I know that under the previous administration, there was a tremendous, previous PLP administration, there was a tremendous push towards national health insurance. Some parts of that have been implemented, but again, from a policy perspective, what can we expect to see from a national healthcare insurance policy perspective from this administration?
Well, first of all, in our former PLP administration, we were the ones who launched National Health Insurance, universal primary health care component, with a lot of pushback. Fortunately for us, the former administration took the baton, and we are now seeing much more improvement as it relates to providing those primary health care services throughout the country. I think the last report indicated that there was about 170,000 Bahamians who have signed up with NHI, and those primary health care services are being delivered throughout the country, and that is good news for the Bahamas. We need to take the universal primary health care component to a higher level so that we have equity across the system where these services could be provided in our family islands. But in our speech from the throne, we made it very clear that the next step for NHI is to be able to provide catastrophic healthcare insurance. The reason why that's important is because still in our system we have a backlog of individuals who need to have life-changing surgeries, but the services are not fully provided at our tertiary healthcare services at the Rand Memorial Hospital or the PMH. The way that's done is that we need to be able to get our people to have those healthcare procedures done so that they can get on with their lives.
If memory serves me, though, sir, in the former PLP administration, one of the biggest issues had to do with being able to pay for all of this and who was going to pay for it. As we look at that now, what's going to be the consideration?
Okay. Our next step for the provision of catastrophic health insurance is to first put in place selective catastrophic insurance. Selective catastrophic insurance is a mechanism of paying that is subsidized by the government. We cannot have these individuals lining up for years for life-saving procedures. It could be orthopedic, it could be cardiovascular, it could be neurosurgical. We need to be able to deal with some of the waiting lists and to find a way how to underwrite these services, if not in the public system, into the private system. The reason why that's important is because as we do selective catastrophic insurance, we will begin to demonstrate to the Bahamian people why it's absolutely necessary to go to catastrophic health insurance. And there's many options on how we can pay for it. It's just a discussion we need to have with the Bahamian people, and we intend to do it very shortly after we initiate selective catastrophic insurance.
We'll have lots to talk about once that comes to the fore. So we're going to take our final break in the show. We've got a few more questions to give to you, but certainly stay with us. On the Record continues on our final segment. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. This is our final segment. I'm your host, Jerome Sawyer. Tonight, we're continuing our conversation on managing the healthcare crisis with the promise of new healthcare facilities, even as COVID continues to absorb the healthcare facilities. The new government has inherited a crumbling, overburdened healthcare system where demands constantly outpace the supply and costs are insurmountable. Healthcare Minister Dr. Michael Darville is my guest tonight here on the record. You chuckled when I said it's true. You have inherited a nightmare in health. I mean, I still don't know how the healthcare system functions some days because I know the demands are so great on the system. One of the things, though, that the PLP has promised, 2 new hospitals, one in New Providence, one in Grand Bahama. That's been challenged over and over. Even the leader of the opposition says it's impossible. Where are we going to find the money? How are these going to be built? The PLP your government has maintained that you are going to build these new hospitals. You're the minister now. How are we going to build 2, not 1, 2 new hospitals?
Well, Jerome, the only way it can happen is via public-private partnerships, because the present economic crisis in our country makes it virtually impossible for us, by collecting taxes, to be able to accomplish this. We have looked at this in the former PLP administration, and a lot of work was put into driving the healthcare services to be able to move in the direction of new hospitals. Mm-hmm. We believe that with the structuring of a private-public partnership system in the ministry, or unit, I should say, in the Ministry of Health, and in conjunction with the Ministry of Finance, we will be able to work out the legal and financial aspects in order to attract direct foreign investors into the country and feel positive that if they invest in these structures for us, we have a workable model on how we will be able to pay back for the investment. We are confident that we have the team in place, along with consultants who would guide us through the process. And since the Prime Minister, or in the speech from the throne, we spoke specifically about these 2 hospitals, the interest from around the world has been tremendous. There are people around the world who would love to partner with our government to see 2 new hospitals built in the Commonwealth of the Bahamas. And they have the economic means as well as the know-how, because they have done it in other countries. And we believe that through this mechanism, we will be able to deliver those 2 new hospitals for us in the country.
Minister, I'm very interested on that. I want to ask you where these people have been all this time, but
they're out there, Jerome.
They're there. Lord, where have they been?
They're there.
What will in this new hospital scenario, what will then become of PMH and the RAND?
In our last term in government, we did consultancies, and I'd like to speak to the RAND Memorial Hospital because we promised the people of Grand Bahama a new state-of-the-art hospital in the last PLP administration. But I realize, as a politician and someone in political life, your time limit is 5 years. Mm-hmm. Unfortunately, we were unable to deliver, but it's not because work was not being done. We intend to dust off that work and begin the process of going back out to the international market for looking for direct foreign investors to ensure that we will be able to deliver that hospital for Grand Bahamians that would serve to provide healthcare services to the northern region. The funding for PPPs is nothing new. And if we look throughout the Caribbean, we would see projects that healthcare projects that use the same modality to be able to construct a facility, and people in that community utilize the facility and improve the quality of healthcare services. The Princess Margaret Hospital, the fate of the hospital was sealed with the critical care block that has been put in place. And so we will continuously work to improve the healthcare infrastructure at the Princess Margaret Hospital while constructing the new state-of-the-art hospital. So that hospital is there to stay. But we need to be able to bring new state-of-the-art facilities to the delivery of our healthcare model, particularly now that we're moving towards national health insurance.
Minister, I also admonish you that, once you are looking to build these hospitals, but even before that, we need not just a vaccine, public health care, or public health education campaign, but we need an overall public health care campaign when it comes to Bahamians. People will prick their thumb and come to the emergency room. They use the services to catch a ride. All kinds of things all happen. And I'm sure the people in the hospital will tell you this, but we need to educate Bahamians on how to not abuse our hospital system, or how to properly use, I would say. We come to PMH for everything. When there's a network of clinics out there, and there are so many things, but I'm against all that. But there are lots of things. There are so many things that we could do to alleviate the stress off of PMH. But our people have to buy into it. They have to know these things exist. And again, even with changing, I think, our lifestyles, it has to be a cultural change. We have to educate our people about how to use the public healthcare system.
That is absolutely true. One of the challenges we have is that our polyclinics in New Providence, they're bursting from the seams as well.
Wow.
And we need to redefine whether or not we're going to use them for urgent care, and how we're going to have the primary healthcare component aspect, and try to debundle it. If we don't, we're going to find individuals who have real emergencies showing up at our clinics, and by time as they get access to healthcare, their situation can deteriorate, and then we may need emergency services. So there's a lot of work to do, and one of the things we need to do is change the policies as it relates to delivery of healthcare at our tertiary and at our primary levels throughout the country. And we're looking at it, and we're working very closely with PAHO, who are guiding us to modernize policy decisions in order for us to do it more effectively.
To say that you all have a lot of work is an understatement. In your address to the House of Assembly, in the House of Assembly on Wednesday, you spoke to a new structured healthcare system integration. I hope I got that right. Could you tell us or explain to us really what that is?
I've been in healthcare for many years, Jerome, and in our last PLP administration, I worked very closely with the Ministry of Health. So I'm quite familiar with the challenges and the policy challenges that exist in delivering healthcare throughout the country. When I came to office at the Ministry of Health, I realized that the policy arm of the ministry has been gutted, and not much work has been done in order to initiate more modern policies in order for us to deliver healthcare. I look at the state of public health and the fact that there was no director of public health in the last administration, and so that space is a void. And then I looked at the state of our clinics and the challenges for infrastructural upgrades, and to be able to provide more structured services at our clinics. And then you begin to look at NHI, and then you begin to look at PHA, and you look at how they're structured at almost quasi-government. And you see the strides that NHI is making, and you see the strides that PHA is making, because they have a different modality of delivering services. And when we look at, unfortunately, the Ministry of Health, and the fact that much needed resources and manpower resources is not available at the ministry. We have some good people, but we need to fill those voids and begin now to operate as an integrated network and not leave our hospitals behind while the delivery of universal primary health care via NHI is going well, and PHA is moving in the direction, and the Ministry of Health resources are being depleted, and we are unable to adequately deliver the quality of healthcare services we need for the Bahamian people. So we have to integrate, and we must begin to get the policies and possibly even amendments to certain acts in order for us to accomplish this goal.
I was given the opportunity a few weeks ago to be able to visit the Princess Margaret Hospital, thanks to PHA and the folks over at PMH. Gave me some unprecedented access. And so I was able to encounter, I would say, some of the issues there at the hospital. One of the areas I think that probably troubled me the most and got the greatest public reaction was our visit into the morgue and the facilities there, and how, what they're having to deal with. Your government has indicated plans for a new morgue. Any timelines or anything on that?
You know, as far as our plan for the construction of new hospitals via PPPs, there's many proposals that are on my desk on how it should be done. But I must say this for the record, that I visited the morgue and I had an opportunity to speak with the pathologists and the staff at the morgue and see the conditions that they're working under. I assure the Bahamian people and those who are in those conditions that we are now moving to bring some immediate relief in terms of upgrades at that particular location. But I agree that they have outgrown that facility and we need to look at something new. But while they are there, it is our responsibility in the Ministry of Health to improve the physical plant, the working environment, and the way the private sector, mainly the funeral homes, interact with the morgue in order to provide quality services. I've had a quantity surveyor, I've had some engineers look at the place because there's some concerns, but we are now in the process of working diligently to scope work in the first phase in order to actually address some of those needs that exist.
That was a disturbing visit for me.
Yeah.
Just to see the conditions and what they were.
Likewise.
And I'm sure there are other areas that you would have visited in the hospital as well that are in need of urgent attention. And so I admonish you, whatever you can, to be able to fix some of the conditions there for the people who work there. Let's talk a little bit about the shortages that have occurred, and ongoing shortages within the healthcare sector. A lot of nurses were lost to retirement, resignation, and a significant amount have gone in other jurisdictions to work. Even some doctors have uprooted and gone. What's the plan now to incentivize our healthcare workers, even our nurses and doctors, to ensure that we keep the best quality healthcare workers and they aren't wooed away into other countries, and we have this brain drain and drain of resources?
It's been a concern that has plagued the healthcare system for many, many years. And with COVID, the situation has become progressively worse. We're losing our healthcare professionals to the developed world. That is a reality. Fast as we train them, we have recruiters that come from around the world to get them. And that's a good thing for our healthcare industry because we have good quality training and we have good quality professionals that come from our system. They're English speaking, they know how to interact with people, and they can easily be transplanted from the Bahamas into a developed country and function effectively. But for us who are at home, it leaves a massive void because we're trying to provide healthcare services with limited resources and manpower resources that you cannot just snap your finger and bring them into the system.
Sure.
So I've had the opportunity to speak with healthcare professionals, our nurses, to find out ways on how we can prevent the brain drain, how we can improve training by way of the University of the Bahamas for subspecialty training for our nurses, and find ways to bond them to the system, how we can find ways to give them incentives with the possibility of finding reasonable housing, how we can find ways to assist them with training of their children. And so incentives one of the areas that we're looking at, because when the recruiters come, they come with a higher salary and massive incentives. And how do we compete with that? And so we have to come to reality that the present financial structures and payment for nurses who are coming out of the nursing school, we need to look at it because it doesn't match what is happening around the world. And also, we have to keep pace and to be competitive. Secondly, we have many other very dedicated workers, from those who actually keep the facility outside clean to our workers in the hospital. Some of them have been left behind. And so we have a lot of manpower issues in the entire healthcare system that I have confronted, even with my tours into the family islands.
Not just doctors and nurses, I just want to say that, not just doctors and nurses need that attention, and they're not just the only ones who are out there working on behalf of the Bahamian people and saving lives. Sir, we're out of time. I want to thank you so much for coming. I've said this to the public, Dr. Minister now, Dr. Darville, several times supposed to come on and on the record, but I think the timing is perfect. You're now in a position to really answer some serious questions. We, of course, will have you back, but thank you. All the best to you. I know you've got a lot of work to do, so all the best to you, and we'll be certainly here to keep an eye on what's happening and to inform the Bahamian people as necessary.
Well, thanks a lot, Jerome. For my position as minister, I've been anointed with fire. And so it's very important that the Bahamian people be patient, because many of the things that need to be done will take some time. But I assure them that we are committed, and this administration have the political will to do some transformative changes in the Ministry of Health, and I intend to live up to those obligations.
And we'll certainly be here to keep an eye on all of it.
Thank you.
All right, so that's going to do it for this edition of On the Record. Special thanks to my guests, also my technical and production staff. We'll see you again next week, same time, same place, right here on The Record.